morning, guys. I come across a disastrous eye transplant results recently. Kindly remember, it's not a repair transplant, it's kind of a disastrous transplant. Because why I'm saying this is, as someone who has done a transplant to this patient, I think I was just shocked to see the kind of primitive techniques they used, it kind of implanting plugs and more than measuring 5 to 6 millimeters. That's a kind of old primitive technique, like a biopsy punch, and even harvestation done the same manner. And this happened could be because of budget lucrative packages transplantation offers that's going on the internet or social media. Probably that was the thing which made him to decide and done this transplant. At the end of the day, it ended up kind of a disastrous outcome. And this is what my feeling when I met him first in my consultation. Kindly watch this video to understand what are the consequences, what are the scenarios, and how did we repair this disastrous transplantation. Kindly watch the video to understand the outcome and everything. Thank you. Today during my consultation when I met this man, it's kind of shocking to me because a frontal hairline, if you can observe, kind of plugs. We say macro and micro grafts being implanted, that's measuring more than 3 to 5 millimeters or more than that. These are kind of a plugs they implanted without having any aesthetic sense, without having any surgical principles expertise. As someone has done, that could be a technician, I don't know. This is because most of the guys are looking at the transplantation cheaper cost. So if you keep on searching for the cheaper options, end of the day you definitely ended up in kind of this kind of a pit, and where you cannot even repair it, because I'm sure none of the surgeons would take this kind of a patient, because it's a kind of a more stress to surgeon to repair and it needs more time. So most of the guys will not show interest to repair in such cases. And that's the one thing I observed. Second thing is implantation in the crown area. Just forget about the angulations. Implanting the bigger grafts like macro and micro graft tufts made the skin so fibrosis where repair was kind of impossible. Next, harvestation also done same. If you can observe the donor area, kind of a patches, if you measure it more than 5 to 6 millimeters in size, that's an old primitive technique someone is utilized. I really don't want to name this. These guys harvested in an erratic way and just implanted an erratic way and said they have done 4,000 grafts. Kindly remember this, because most of the patients are telling me, you are offering me for 3,000 grafts. Most of the clinics are offering me 6,000 grafts, double the number what you are quoting. I would go there because it will be cost cutting for me. It's absolutely wrong. Someone can do 6,000 grafts. An expert surgeon been doing 18 years also can able to do 6,000 grafts to you. It's not the question of the grafts here, it's a question of the quality. I'm sure there is a number of grafts limitation given by your donor itself. That's called safe donor limit. We cannot cross beyond that. Here, this disastrous outcome happened just because of the lucrative hair transplant package. So here, there's a disastrous outcome of hairline and disastrous implantation in the crown as well, and donor also one side completely damaged. I'm so happy left side and the mid scalp is still preserved few grafts that have a room of choice to repair it. That's the thing I just observed during the consultation. Let's see how did we repair it, what are the consequences, what are the challenges that we faced during this transplantation repair. Kindly watch the video until end to understand. Well, when it comes to the plan, we have in our mind to remove few plugs in the frontal area as well as the backside crown area, removal of the plugs. Kindly note, these plugs, when you implant it, that's kind of 5 to 6 millimeters more than that size, very difficult to remove in a single session. We need to remove it, and reimplanting also is a very difficult task. And by default, this patient had baldness in the frontal area as well and crown area as well. would definitely need second session. But again, the repair is adding to it. That's the kind of disastrous outcome. So we have planned to remove few plugs, around 80-90% of the correction, and removal of plugs in the crown area also. Across session, probably repair the donor by implanting few graft. That's the plan. Well, in this session, we had in our mind remove the plugs, little higher airline I supposed to take, because a lot of work to do, and remove the crown area macrografts also, and reimplant the crown area. That's what the plan, so that we can get at least 80-90% change in one session repair. After 8-9 months, it happened to same. If you can observe, the 80-90% of the plugs in the frontal area have been removed. For such patients, I'm sure they would need a second session also to remove the femur plugs and reimplant it. Crown, if you can see, I'm so happy with the outcome, because I'm sure still gaps are seen, but I'm happy because we implanted here, we addressed here both front and crown area. It's not a joke in a single session, and I'm so happy with one session getting this kind of change. And if you can observe, the crown area improvement is really good along with the frontal area. This patient, if really interested, we can definitely do second session with more density and more plugs removal also. So that's the end of the one session. We achieved it. So one should always think about getting it done in a transplant with the expert surgeons. These are the few reasons. I would like to make a practical video. This is one of the disastrous case I've ever seen in my practice. This is not even a repair case. This is a kind of a disastrous outcome, I can say. So there lies the difference between selecting the best clinics, best doctors, and amateur clinics to perform your cosmetic surgery. These are the practical examples one should understand before going through your selection of the clinics. Conclusion of such experience from these kind of patient is, what I would say is, most of these kind of transplantations happen because of lucrative budget packages, number one, where patients are behind low cost hair transplantation, which is impossible to do, because when someone go for the low cost, there are always someone who can charge less than this guy. So you end up in getting with the kind of a disastrous clinics with the disastrous techniques and disastrous instruments. I'm sure each clinic follow their own techniques, but who's using kind of quality instruments are definitely important. You're going to, it's kind of safety is going to task. Very important to understand this point. Number two is, most of the guys will simply promise you 6,000 to 8,000, 10,000 grafts, which is impossible. One should try to understand this. Someone, best surgeon gives you an idea of getting it on 3,000 grafts. Someone will give you a package of 6,000 grafts, which is something which is not possible. So you think that fine, I'm getting double the graft for same price. There lies the trick. So it's not a question of the graft, it's a question of the quality. You should think, nothing else. This is another reason why most of the people are falling as a prey for this kind of things. And third reason is promising erratic way. Whatever the way you want, they're promising without even just giving an answer and explanation to the question you asked. Just they say yes for everything. Again, lead to your kind of selecting the amateur clinics or technicians operated clinics, whatever it is. These are the few reasons why. These are feedback I got from the patients, and these are the few reasons why these kind of outcomes will happen. So I would request you guys to go with comparison with equal surgeons. When you are selecting few clinics, kindly compare between them, not to compare with somewhere someone never got any quality or good results with the best surgeon. It doesn't make any sense. So if someone always goes by the cost cutting, definitely they end up in kind of this kind of disastrous treatments. I'm sure, and India is one of the best place, cheapest transplant. You can get it done with the best surgeon, no doubt in that. So if you can go around and see in throughout the world's best surgeons, Indian best surgeon cost will be somewhere more than 20, 30 times lesser than them. And kindly compare that way. So go with the best surgeons and compare the quality. So these are the things one should understand, and see the repair surgeries, who is able to perform the repair surgeries, and see the most of the results than only watching some kind of a videos placing only bandage or implantation. That doesn't make any sense. Implantation photos for you as a patient, if you see all those things, it doesn't make any sense. All the way you need final results to compare. So kindly observe these points to choose the best clinic. Then you can make up your choice to go with. Then I'm sure you would end up in a best hands. That really helps you. Thanks for watching our videos. I keep watching our videos to get these kind of interesting updates with the videos and I think this will be very useful for many patients. Thank you.